Well, implants, first of all, have completely revolutionized dentistry in that if you lose a tooth, it's not the end of the road anymore. We can replace it. We can give you literally a new tooth that you chew on, you brush, you floss, it never comes out of your mouth. And it's changed dentistry because we have the ability now to replace teeth that are gone. Which makes the conversation about having to pull a tooth a lot easier because there's definitely a way to fix it.
An implant is very stable. It's something that's a long-term restoration. It helps the patients to have better ability to aesthetically have a nice look and as well as function.
Implants are generally required when a person loses a tooth, as an extraction. And that kind of an option, you have the option of doing the bridge, or you have the option of doing the implant. Implants are very nice when the adjacent teeth haven't had any restorations and you don't want to touch those or cut those down to do a bridge. Implants are the wave of the future.
It's essentially a surgical grade titanium screw or post that we place into the bone in the area of the missing tooth. That surgical grade titanium will then fuse with the bone over time and become just as strong as any other tooth in your mouth. We then put a crown on it and you chew on it and it's just like every other tooth.
Implants are important because if a tooth is extracted and the space is left, the adjacent teeth begin to shift, and the tooth that opposes that space shifts down into that space, which can create a bite that is off.
You do not have to maintain it in the same way you do a bridge as far as taking care of it.
Over time, naturally, all teeth drift forward towards the middle. And so if you're missing a tooth, the teeth behind it are going to start to get crooked. They're going to start to throw your bite off, make chewing even more difficult. And over time, you could potentially even lose the ability to get an implant in that space because you've lost bone or because the teeth have drifted. The longest term negative effect also is you will lose bone in that area, which could, potentially threaten the teeth around it. So it's always a good idea to have something in the bone that's being used that stimulates that area of the mouth to stay healthy. And that's a big benefit long term of getting it in.